Yeah. Iron is another really big one for fertility specifically. A lot of us think of iron as essential for energy, maybe sleep, maybe things like that, but it also is really essential for ovulation and reproduction. It helps because when your body is low in iron, your body prioritizes survival over reproduction. Your body goes into a type of stress. And so your body needs iron to feel nourished and supported for pregnancy. And low iron affects the blood flow to the ovaries. It decreases the body's ability to ovulate regularly, which of course is really important for fertility. It also affects the lining of the uterus and how receptive it is to implantation. So, same as vitamin D, this also helps with implantation. And so, especially if someone is having really heavy periods or you're feeling tired often, or sometimes if you look at your fingernails and you notice that your nail beds are a little bit more white than usual, could be a sign that your iron is low and you should be getting tested to get the full picture for that and supplement as necessary.
Now, a piece, Marina, I want to go back on for both vitamin D and for iron because we've talked about kind of like a female reproductive aspect of it, right? The ovulation pieces like that. But would this hold true, say, for men who are struggling with infertility? Because we don't really necessarily, or some people don't even think about that as part of the equation. So, do these also hold true for women and men as well?
Yes. Vitamin D is essential for both. Iron is more a little bit more looked at for women than it is for men, primarily because women are more at risk for deficiency, and because the uterus needs such a high volume of blood to support a healthy pregnancy. So, iron definitely for women, but both are super important.
Okay, good. Okay, so let's talk about, let's flip a little bit. Let's talk back to the iron because not all iron is the same, not absorbed the same. And we also know we potentially might have listeners who are vegan, vegetarian, not um, animal consuming, which then this actually has many different ways that this can go because iron isn't a simple conversation either.
Yeah. Well, we could talk for a very long time about iron, but to simplify things, iron comes in two different forms. There's the heme iron, which is primarily animal foods. It is more easily absorbed. So you find those in options like red meat, liver, shellfish, poultry, those types of things. Non-heme iron is more from plant-based foods. It's less readily absorbed, but it's still a really good source of iron. So those are things like lentils or spinach or fortified cereals or seeds. So both options are needed to help your body absorb more iron. We need to pair them with a vitamin C rich food. So, for example, if I'm having a spinach salad, the spinach would be your iron rich source, and then maybe having some strawberries in the salad there. Or if I'm doing lentils, maybe I'm having, a salad that has bell peppers on the side, or, things like that. When we pair with vitamin C, helps with absorption. We also need to avoid drinking coffee or tea with iron rich meals because that binds the iron and decreases absorption. So those are things to, be mindful of as well.